New Futures is one of the most respected and important policy, information, and advocacy sources in the state of New Hampshire. This state would be far poorer without having their voice in the discussions about health issues and wellness issues.
One of the things that makes New Futures unique and valuable to our lawmakers is that we provide them with the data and the information they need in order to make informed decisions. Our electeds are volunteers. It's an unreasonable expectation that they all be experts in everything. If we can provide them with the resources they need to hear from their constituents about the real problems in those communities and tie it to a tangible policy solution, I think that's the value add that we bring to that conversation.
Oftentimes what New Futures does is they not only come forward with an idea, but the solution, and they're highly respected in Concord and in the State House, so it's easy to work with them.
They know they can trust us, that we are not going to be putting something before them that's not a well-researched solution to a documented and significant problem. And they know that if they are putting forward a policy that New Futures is supporting, that we're going to be there with them along the way.
They were one of the lead organizations for Medicaid expansion. That is so important for mental health, substance abuse, that people have access to Medicaid. So they developed a huge coalition, did an unbelievable job of convincing people in 2014, in 2016, in 2018, and again in 2023, that Medicaid expansion is right for the state of New Hampshire. So it was advocacy, it was information, it was fact-based, and it was, the personal stories that folks in this building need to hear.
Stories help our elected officials understand and contextualize a problem. It humanizes it for them, but it also helps them see an actual person who will be impacted by the policy and the decision that they're about to make.
A few years ago, our family was in crisis. Our son needed mental health supports, and it got to the point of it not being safe for him to be at home, for him or for us. We called the mobile crisis team several times, and they tried to connect us to services. But the suggestion was to go to the emergency room. And when we went to the local hospital, it resulted in us having to drive to Massachusetts. We spent 8 days on a stretcher in the emergency room, 11 days in cardiology before they were able to find him a bed on a unit that was able to give him the help that he needed. He spent 6 weeks there. During that time, it was important it was becoming apparent that his story needed to be told. And so when the opportunity came up to testify in support of a bill that would help families not go through this and have more supports, it was the only right thing to do.
Shauna's story is a story about the need to invest in the state system for children's behavioral health. And it changed the conversation from why is this something that we should do, or this is a parent's problem, to this is a very serious state and community problem that our elected officials and our lawmakers have a responsibility to address.
It makes me feel that I had a little sliver, a little part in helping make a difference.
Our legislators don't want to hear from me on every issue or our policy staff. They want to hear from their actual constituents who are grappling with these problems every day. And our role is to empower those people to have the confidence in their own experience to engage directly with their own lawmakers.
Those are the stories that, got a 24-0 vote in the New Hampshire Senate for my bill, House Bill 263, and we were able to include it in the budget. That doesn't happen by accident. New Futures certainly is one of the organizations that brought this coalition together did their job.
There are just so many hyper-partisan and commercial interests that are lobbying our $100-a-year legislators. They need to have somebody they can count on who will give them honest, unbiased information. And if New Futures weren't around doing this, I'm not sure who else would step in who would have the credibility of not being identified as on somebody's side or the other, just there looking out for the health and wellness of New Hampshire.
Through direct service, you can help one individual, but through policy change, you can help everyone. You can see it in the number of people who've been served by Medicaid expansion, the investments in the state alcohol fund, investments in childcare. Those things were made possible through policy change, and they're lasting changes.
New Future's doing the work behind the scenes so New Hampshire families can get the supports they need, but additionally, and it's something I've talked to my son about, there's just this force of people to be reckoned with that are behind the scenes, that are spending their days advocating on our behalf. And we don't know them, and you will never know them, but they're doing it for kids just like you and families like us.